not just good enough to say we've got 85 or 90 or 95% of the people covered with basic forms of healthcare. We need 100%, and we need to constantly be improving how those services get delivered. Now we spend about half of our research and development, which is over $1 billion a year in healthcare alone, on technologies that we think will improve affordability and access. Because there's 1.5 billion people in the world that don't have basic access to healthcare.
What is it? What's big data?
Okay, what's big data? I'm sure all of you would have your own definitions if you asked that question.
Even in 2010, a clinic in the US would have 1 billion terabytes of data. And to put that into context, that's the same as having 2 trillion filing cabinets of information. So we're already there. We're in the era of big data. The challenge really is how do you actually make sense of 2 trillion filing cabinets of information.
You have that potential to be able to, while you're treating individual patients, also be pulling that information together so that you can understand those overall patterns.
The power of what we actually are able to do with the increased data sources, the ability to really focus what are those questions that we're trying to solve and have the right people to try to solve them, that will actually enable where we need to get to in healthcare.
The average Australian would go see a GP 5 times a year. Mm-hmm. That's less than an hour with your GP. And most of the time that you're going to see the GP, it would be with something acute rather than those underlying chronic issues that are going to come back to hit the health system in crisis and be dealt with in an expensive and inefficient way. You can see that opportunity for significant preemptive impact.
The system is so complex and it's so interrelated, and it's just a massively complex system. It's too much for the human mind to be able to make sense of and say, oh, that's how to fix that problem. So I think that models of the system can be extremely helpful.
Even the way that evidence is published in health needs to change. I remember reading an article a decade ago that said that a GP had to read 17 journal articles a day just to keep up. How do you distill that amount of research and make it available at the point of care? And that's what you're looking for, is really decision support systems.
Opening up that data to teams of people that include clinicians, health informaticians, data geeks, IT geeks, entrepreneurs, and as well as the creative types as well. So there's a lot more people with design thinking aspects that are coming into healthcare now. So I actually think that there's some really beautiful opportunities there to actually broaden these challenges that we have in healthcare to a wider group of people to help us solve them.
Health's greatest challenge is still its fragmentation. The left hand doesn't know what the right hand's doing. People making decisions about your health are partially informed. They're highly educated, but they're partially informed because it's hard to get all of your information to the point of care where they're making the decisions for you or with you.
Creating a more effective and efficient, continuing to create a more effective and efficient healthcare system, is a national challenge, and we need to look at all angles for how we get there.